bench, put the other one together, and so it's there. It's immune to do that, so it won't to me like this little.
Okay, so good evening, everybody. My name's Stephen Davies. I'm chair of the Schopwick Patient Participation Group, which is a small committee of people who give up some of their free time to be a sort of independent body between the surgery and patients. And we're there to help doctors as much as we can with putting on things like this. If you fancy joining our small committee, we have a few vacancies, then please feel free to email me at the end of the evening. You've got the email address of shopwick.nhs@nhs.net. I'd just like to remind you that we are recording this talk this evening, and it will be available in a couple of days' time should you want to catch up or you miss anything on the website, so watch out for that. If you're looking or watching this on a mobile phone, you might find it better to turn it to landscape. Our speakers tonight are Dr. Nicholas Small, Dr. Raj Badiani, Dr. Alex Byrne, Simon Phillips, our senior clinical pharmacist, and they're all going to have something to say to you about this new system. But first of all, what I'd like to say, if you've got any questions, please use the chat bar at the bottom of the screen and ask your question, and we will pick it up and come to it as soon as we can. Obviously, if there's lots of repeats, then we'll find that a little bit difficult and we'll just merge them all together. But initially, what I'd like to say, most of you probably know by now that Dr. Nicholas Small is retiring in a couple of weeks' time, and sorry, a couple of days' time. Thinking we're in mid-September, couple of days' time, and I, on behalf of our committee, and I'm sure on behalf of a lot of, or most of you patients, would like to say thank you to him for all his work he's done over the last 26 years, 28 years maybe. But, you know, it's been invaluable. He's been one of the most interesting doctors you could possibly talk to. He's been involved on all sorts of fronts on the NHS, backing us to improve ourselves throughout. We are now one of the, or we are the leading surgery in the area. So that's all down to him and all the other doctors. So without further ado, I'd like to introduce you again to Nicholas, who's going to speak first of all. Thank you, Nicholas.
Thank you, Stephen. Those are very, very lovely words. And you might well ask, if I'm actually coming to the end of my time at Schopwick, why I would be introducing. And I just want to be absolutely upfront with you. I think that this is a really, really important change that we need to do. It's important that people understand the background to this. So I won't go into all the details, but earlier on in the year, the government decided that they wanted to increase access to GP services. And one of the things that they asked practices to do was to change the way in which they handle calls and requests for appointments on the day. So and that really is that there should be a destination. So it doesn't necessarily mean you get an appointment, but you get a destination of what would be the best way of helping you with the query that you've got. And if we only did that on our telephone system, and at its peak, I have seen 1,800 calls in a day at Schopwick. would literally bring the surgery down. There wouldn't be any opportunity for people to even get through, even though we've got one of the modern telephone systems that people talk about. We invested in that quite a few years ago with our own money. So that's the background. And what has really impressed me about our partnership, and I also mean not only the doctors, but all of the clinicians, and Simon being a very good example, is that we've all been talking about how to make this change and to do it in the best way for patients. So we've actually gone for a system which isn't widespread throughout Hertfordshire, called Patches. We've actually decided to invest in that ourselves because we think it is the one that is the most intuitive. And the other big thing that we've done is we've spent a lot of time talking with our patient group and trying to iron out some of the things that may happen. So there won't be an early morning rush, or there doesn't need to be anymore. And we are going to increase the number of appointments that are available for increased demand. So that's everybody's going to work even more efficiently, even harder to try and deliver this for you. We want to, and I feel genuinely, this can improve continuity of care. It can allow people to see the right doctor, the doctor that's their normal doctor when they're available, and that is something that others in this talk tonight will discuss further. We also, I think this is really important, we want to improve equality of access. So what we have at the moment is a system whereby those that get through first in the morning actually get an appointment, and maybe others that actually really need it we have to put onto the duty doctor list in the afternoon. We don't think that's the best way of helping our patients. And we really want to improve patient outcomes. So whatever you hear tonight, you will, it doesn't mean you can't phone the surgery in the normal way. So if there are problems about computer access, or people have got some memory issues and they need to actually interact with our surgery in a sort of a way which isn't by computer, that's absolutely fine. I just want to make that absolutely clear. And we've done everything, and I can't tell you how much our other partners, who are really talented, have worked on this to try and get the very best service we can for you. We know it won't be perfect. We know that there will be some teething problems, but we will, as always, respond to those and try and adapt to it. So I'm really positive about this. I think it will give you much better continuity, because that will be explained a little bit later on. And hopefully the phone lines will not be as busy, and that will allow people more opportunity to interact with our patient coordinators than they have in the past. So I don't think there's anything else to say other than I think that Schopwick has always been there to be innovative. So we're trying to do this new system, which is being pushed by the government, but we're trying to do the very best we can for our patients with it. And we've invested, as I said, a lot of time, energy, and I don't think there's anything more I need to say other than to hand on to Raj Badiani, one of our partners, who is going to talk you through some more of the details. So over to Raj.
Can I just interrupt for 1 second?
Yep.
Thank you very much indeed, Nicholas. That's a very good introduction to that. I noticed one or two of you are asking questions, and some are asking directly to me. If you could direct your questions to the whole group, then others who may have a better knowledge of the questions rather than myself will be able to answer you. I can see one, for instance, saying I cannot see it on an NHS app. You have to have signed into Patches, and if you do go onto the NHS app, which I'm sure Raj will tell you about shortly, there is somewhere where you can and I've used it myself, where you can log on to Patches or log on through to your surgery. Anyway, thanks very much. I'll hand you over now to Dr. Raj Badiani. Thank you.
Thank you, Stephen and Nicholas. I'm going to explain to you now a bit about our new appointment system, including what Patches is. Patches is an online tool through which you can book appointments, you can request medical advice, and you can also put in administrative queries. We currently use Patches for routine queries on our website in a limited fashion, and we've had some excellent feedback from patients that have used it. We're looking to expand this in order to improve our access and improve the way that we can offer appointments to people and to see the most appropriate person you need to, and improve continuity. So Patches itself is a quick response system through which you can put all of these queries in. Each request will be promptly assessed by our senior GP-led team, and you'll receive a response the same day to that request, no matter what. And to move on, I'm going to show you a flow chart on the system and show you it. It's not too complicated. At the moment, our current system is that patients will either phone the practice to book an appointment, or they'll visit the practice in person. And now, like Dr. Small said, patients that visit the practice often get an appointment before those who are holding on the phone, and it's a first come, first served basis. When looking at the system, the utmost thing we looked at was to make sure that it's a fair system, and also to make sure that our vulnerable patients are not disadvantaged in terms of booking an appointment. So in our new appointment system, we're opening up this option of the website, which is Patches. So via our Schopwick Surgery website, you can go through to Patches and place a request on there, and we would encourage people that don't specifically need to call to do that, so that they can so that we can reduce the queues on the phones. The important thing is that our patients who can't use technology are very important, and they can still call the practice as they normally do, and our practice coordinators will help them place a request. All of whatever way you put it in a request for advice or an appointment, whether that's via the website, via telephone, or by visiting the practice, all of this will be placed in the same inbox for our GP-led team to assess. So your requests will be looked at and assessed by someone who's clinical. So part of our GP-led team, and ultimately led by one of our senior GPs. And then the outcome of that will be communicated back to you by one of our practice coordinators. If you're someone who's used it via the website, that will be via text message or perhaps phone call. If you're someone who is not able to use technology and has therefore requested this by telephone or visiting the practice, we will give you a phone call back in order to tell you what the outcome is. And on the right hand side, I can show you all of the possible outcomes. All of these are available at the moment, but it's important that we use all of our resources properly, and you see the most appropriate person. So having someone clinical, like a GP, who looks at your request will ensure that you get the best outcome for your appointment, and you get continuity if you need it. And so the different options for potential outcomes for an appointment will be a face-to-face appointment, a telephone appointment, a video consultation, medical advice if that's all that you need, or a referral to one of our excellent community services like the community pharmacy. We have a mental health worker, a social prescriber, and if you need appointments in the evening and weekend outside of Schopwick's opening hours, there's also our extended access hub. The important thing to note with this is we are not forcing patients to have a consultation just online. This is an appointment booking system. So we're triaging the appointments, and by that I mean we're assessing the need for the appointment and what kind of appointment you need, and then we will offer it to you. So, and in fact, the number of appointments we're offering face-to-face and telephone is not going down at all. And in fact, there'll be more appointments available because of the fact that we're allocating them appropriately. And for patients, so patients will be offered what we feel that they need. If the patients feel that they don't agree with that, or they have some more information that thinks they need to see someone different, they can call the practice back and we can discuss it, and we can try and arrange what they need. It's important to note that our practice nurses appointments are not currently being booked in the new appointment system, will not be booked using Patches. And if you need an appointment with one of our practice nurses, so for example for wound care, for immunizations, or for health checks with our nursing team or healthcare assistants, these need to be booked by phoning the practice. And we're hoping that with this system, the phone queues will be significantly less, and that will make it much easier. And with that, I'm going to pass it on to Simon Phillips, who's our lead clinical pharmacist, who's going to talk about the different members of our clinical team and our GP-led team.
Thanks, Raj. Yeah, so the model that we're working within now is, so in hospital, you see a variety of different professionals. So you won't just see one doctor, you'll see various specialists, you'll see nurses, you'll see pharmacists, and we're trying to copy that model in the surgery as well. So you'll see lots of different people depending on what's going on. Raj, do you mind going to the next slide, please? I'll carry on. Okay, so there's a sort of a long list of different people you might see. I'm going to cover them all. So top of the list is a GP. So I think everyone's interacted with a doctor, GP at some point, and an expert in diagnostics and management of long-term conditions. And there are multiple roles that now supplement that. So another role that you may have come in touch with is the advanced nurse practitioner. So these are nurses who have advanced training to manage new conditions or minor illnesses within their sort of scope of competence, which is essentially within what they're comfortable to manage, what their skills, where their skills lie. As an example, one of our advanced nurse practitioners is Gemma, who was a specialist nurse in heart failure. So she has huge experience in this area and manages lots of our heart failure patients, which is incredibly complex. Practice nurses, so these are nurses you might go for wound problems, immunizations. They can do asthma reviews as well. And to supplement the nurses, we have healthcare assistants who can do things like health checks or blood tests as well. So then I myself am a pharmacist, and we have a team of 4 people. All the pharmacists have slightly different areas of slightly different skill sets. I suppose the main role, the most common role of a pharmacist based in the surgery is to manage long-term conditions. So it could be diabetes or asthma, high blood pressure, any condition that requires review annually will be seen generally by a pharmacist. Our focus, I suppose, is on people who have very complex medicines lists, so what we call polypharmacy. So people who are more frail or vulnerable, who have very complicated lists of medicines, we try to review those lists to make sure the medicines are working safely for you, not causing you any side effects, and that you're happy with them. As I said, there are slightly different skills depending on which pharmacist you speak to. So I'm a slightly more advanced skill set. So I'm an advanced practitioner. So I suppose there's a crossover between my role and the role of advanced nurse practitioner. So I can also manage new conditions and help with the triage as well. A relatively new role is a physician's associate. So this is a sort of medically qualified and trained healthcare professional working alongside the practice team. As someone who've undergone a 2-year intensive training regime, working in hospital and in primary care in the GP practice. And they can also help with that workload of new conditions, new on-the-day conditions. And they can carry out examinations, they can request blood tests, they can do referrals. Forgot to mention, just with the nurse practitioner and myself, we can also prescribe. So it isn't just a doctor who you need to speak to get medication. Moving down, we then have we're very, very lucky to have our musculoskeletal specialist. So this is a physiotherapist. All they do every day is just assess people with new problems such as back pain, neck pain, general joint pain. You have a 20-minute appointment with them, which is double the normal appointment time, and they can come up with a treatment plan and refer you onwards if needed. The important thing to remember with this specialist is that a significant treatment for any musculoskeletal problem is physiotherapy and exercise, and this is the person you want to see to get that done for you. They're the specialist in this area. Moving down the list, we have our mental health support worker. So these are clinicians who provide mental health support and counselling for patients who may be having difficulties with low mood or depression and anxiety. They can assess, and they can also onward refer to specialist services. They can refer back to the surgery to get medication started. And lastly, we have social prescribers. So this clinician essentially looks at what we call the non-medical aspects of health. So there are lots of non-medical things that could influence your health. So for example, if you're an asthmatic, it may be that you're living in damp or inappropriate accommodation, and it may be you need help with housing. That's not something a doctor or a pharmacist or a nurse can help you with, but it is something that a social prescriber can help you with. They can also look at unemployment, welfare, loneliness. So it's looking at all the really important non-medical issues that can affect your health. So I hope what I can demonstrate here is that there's a huge specialist team that works together in various different areas to try and make sure that the treatment you're getting is as best as it can be. And we all work together. So we all sit in the same building, and we all have access to the same records, and we all discuss the cases together. Thanks, Raj.
Okay, Simon, thank you. Can I just stop and ask a couple of questions? Otherwise, I can see we're going to be inundated with questions towards the end. I'm not sure about this one, but I cannot find on the NHS app, even though I've signed into Patches. Is it because Patches is closed at the moment, or that you can't see it on the NHS app? Raj?
So initially, Stephen, in order to connect to the NHS app, you have to register with Patches in order to do it. And so when I do the live walkthrough later, I will show you where you can register, and there'll be options to continue with the NHS app. At that point, once it's linked up, you can use the NHS app to request on Patches, and it will tell you when the requests are open or if the surgery is closed or not on there after that. But without registering, you can't connect it into the NHS app. If there's any queries people have with this, specific things, and sometimes there are specific things that happen with things like the NHS app, which is external to us, so we don't make that app. So there are sometimes some issues with connectivity with specific patients. If you do, you can contact our practice, and a member of our team will help you try and sort that out.
Okay, thank you. I noticed Moira's asked a question, is Patches accessible without using the NHS app? Yes, it is. You'll see about that very shortly when Raj does his walkthrough, showing precisely how you can get into it and act with it. Alex, Dr. Alex Byrne.
Hi, hello. Can you hear me?
Hello.
Can you
Yeah.
see me?
Yeah,
Brilliant. So yes, thank you everybody so far. So we've got 210 people on this talk at the moment, which is just fantastic. We know people do drop in and out. That's why the questions are actually really important on the chat, because we'll be recording the questions as well as this presentation for people to refer to afterwards. Okay, so one of the things that we think is really, really important at Schopwick is continuity of care. So continuity of care is important for many reasons, both for you as a patient to have somebody who gets to know you during a period of whether it's ill health or during a period of your life that you're living in the area. We prefer you to see one or two of our clinicians within the practice, and it actually makes your care more efficient. So it's more efficient because if you see the same person or the same couple of members of the team, we don't have to start at the beginning every time. We know that's really frustrating when you have to start the story all over again. So we know Schopwick is really excellent at access. We've always been wonderful with access. Accessible care, you can see at the top here. This is so, so important. I remember I've been at Schopwick for a very long time. I trained at Schopwick, and in the olden days, 15 years ago, there was never a time where we had run out of appointments. Things have changed, and it's certainly not because we have decreased the number of staff. We've increased the number of doctor appointments, as well as all of these roles we're talking about. We must have doubled, tripled the number of available appointments to our patients, but it's still not enough. So we know that what actually does happen at some point in the day could be 9:30 in the morning, though not usually more sort of 2 to 4 o'clock in the afternoon. We run out of on the day appointments. We move over to a duty doctor scheme, which is not really what we want it to be. We want everybody to have an appointment. They know who they're talking to, when they're talking to them. So that's really what we're aiming for here. So the continuity I've just mentioned, we want continuity, you want continuity. Accessible care, so important to us at Schopwick. And So, you know, coordination here. So coordination, we are coordinating the whole team. We work as a team within Schopwick. Education is really important to us, and we are constantly educating ourselves as well as our team members. Now, we work really well as a team in Schopwick, and one of the things we've done fairly recently is we've created, we sort of moved, we rejigged our reception area, particularly in Elstree, so that rather than having our patient coordinators, who used to be known as receptionists, sitting just answering phones like a call centre, we actually have people sitting around and talking to each other, asking what's best for this patient, what's best for that patient, what shall I do about this? Simon will lean over to me and say, what do you think, Alex? And I'll say, Simon, what do you think about this patient? You know, what do you think about this? Because we all have different areas of expertise, and every time we ask questions of each other and share your care amongst the team, we actually get better at what we're doing, as well as you getting better care. So that coordination is really important. And us working alongside our patient coordinator team, our receptionists, as they were known, team, they are also becoming more skilled. We're upskilling them in what is available. One of the things we didn't mention earlier of the list of roles within our surgery is actually that there is a big link to our community pharmacy colleagues as well. So the link to our community pharmacy colleagues is really important, because at times there are additional services which are what we call commissioned. So commissioned additional funding is put into our community pharmacy colleagues to do a piece of work to lighten our load, so we can concentrate on the more complicated thing. So, you know, an example of this at the moment is the urinary tract infection pathway, where the people with a new onset of urinary tract infections, you know, you've got cystitis and you're a woman between the age of 18 and 65, actually, we can put you in touch with your community pharmacist and they can sort out and test your urine if that's necessary, rather than having to speak to a GP altogether. So, you know, these sorts of things, we know what's out there. We know the things that are available for you in a way, sometimes better than you do. And actually, some of the patients I've known for a very long time, I've spoken to them and they've said, I saw the first contact physio the other day. He was marvellous. I didn't know he existed. And so, yeah, we've had them in the surgery for quite a while. So sometimes you don't, as a patient, you don't know which services are out there, because it does change all the time. You're not expected to know that what's out there. But our job is to actually coordinate your care and make sure you are with the right person at the right time. So that's what we consider to be the person-centered. You, the patient, are the important person here, and it's a holistic care. We are not just saying, okay, I want to sort this part of you. We actually look at your medication. Do you need the blood test? Do you need your PSA testing? Do you need your medication updated? You know, actually, how are you doing? You're a carer. We can do all of this, but actually we'll take the whole team for us to look after you as well as we possibly can. So sorry, I'm gabbling. Raj, can we go to the next page? I think I spoke a bit longer than I intended to there. Apologies if I repeat myself. Okay, so we have gathered, so thank you for those of you who sent in your queries in advance. We were expecting all of these queries, to be honest, and we're expecting lots more queries. And one thing I want to say to you is just, please be patient. This is a new system. We have put in tons of resources, tons of additional resources, tons of additional clinician time. We've got lots of locums to make sure that we are, you know, everything runs as smooth as it possibly can. And we've kind of boosted our capacity at the beginning to make sure that it all runs smoothly. There will be bumps, and I can only apologise in advance for this. Okay, so why can I not call and book an appointment directly? So one of the reasons for this is, as I was mentioned before, is sometimes we know about things that are available to you that you're not aware of. So I find I'm now a senior GP. I still think of myself as a trainee, but I'm, you know, a long way past that now. I would prefer not to see things that can be dealt with by a colleague who has a different skill set. So if somebody has you know, one of our nursing colleagues, they have more skills in a certain area than I do. Simon has certain skills that I don't have. I don't really think it's appropriate for me to see, you know, let's say a new fungal infection in your armpit or something like that. That would be fabulous for one of the other members of the team. because I am going to be good at doing the more complex stuff, and we actually have to save the appointments for the more complex things to the people who are able to do that. I don't want to, for one moment, to say there's a hierarchy, because we don't have a hierarchy at Schopwick, but we do have a sort of a Venn diagram of overlapping skills, and we want to work out exactly where you fit into that. So we would like to direct you to the correct appointment slot, the most appropriate appointment slot. We don't want people to call in, because that's not fair. We would prefer people to use patches online where possible. There's a really, really important, valuable information that you are asked to put on patches, and we'll come to that later on today, that helps us speed things up. Okay, speed things up and answer some of the questions we're going to ask you anyway. But if they're down there in black and white, it's actually a lot quicker to read it and say, right, that's what this patient needs today. Now, as we said, and I'll probably go back to this later, if you are not able to use the IT, your computer, your app, don't panic. You will have the same access as everybody else. You can come to the reception desk. Again, we prefer you not to do that. Car parking issues, we know, enormous problem in Elstree, but also we don't want you waiting at the desk where something could be more straightforward. We are not taking away our terrific phone line system that phones you back. You will be phoned back in order. But what we're going to do is every request that goes on to patches is going to be put through in order of completion. So the one that comes in earlier in the day, it'll be there at the beginning of the day. The person who's queuing at the desk, they will go in, and the person who puts their patches afterwards, they'll go in there. So we will see and maintain sort of a fairness that people won't be able to sort of push in the queue. Everybody will have equal access to our appointments. So that I've really answered the second one. I'm unable to submit my request online. So I am unable to make the appointment offered. We really hope that's not going to be the case, because one of the questions we ask is, what times are you not available? Now, this is really important. We'd like you to be available, of course, as much as possible. And we're hoping to come back to you within an hour or two. That's our aim. You know, if we get a big flurry, if we get 100 requests coming through in short notice, things may take a little bit longer, but we are going to answer you the same working day. So we are going to come back to you with that answer the same day. And so if you say to me, say to our team, I'm not available between 2 and 3 o'clock, we're not going to book you in between 2 and 3 o'clock. We might book you in at 3:10, and we would very much hope that you will have you will be able to attend the appointment if it was a face-to-face that was requested and thought to be appropriate, or the telephone appointment that we're offering. Please do have your phone on you, and it should be the surgery number that shows up. Occasionally it is a withheld number. If the surgery phones are down, we have a plan B. We have our mobile phones, which are switched onto withheld numbers to protect our own personal phone numbers. So please do watch out for those. So you should be able to make every appointment that you offer. If you say I'm only available at 3:45 a.m., that's not going to be possible. But wherever that is realistic, we'll hope to do this. And we certainly do have some slots, after school slots. We've got all of this sort of planned, and particularly Raj and Sarah Harris in the office. They've put in such a lot of work to try and keep our a great variation in the appointments offered from our commuter clinics, starting at 7:30. I can't remember what it is, Raj. I don't do that one. Right the way through until the evening. We have late slots, and of course we have our extended access slots in the evenings and at weekends as well. So we do have lots of appointments available to you. Now, the next one, I only want to see a GP. Now, I'm afraid that is not possible. It may be possible that you see a GP. It's in the same way I only want to see a consultant in the hospital. I'm going to take the same sort of explanation that Simon gave you earlier. I only want to see the most senior person in the team. That may not be possible. I do want to say that every request that comes through, every assessment is done by the GP team. So our team we call it triage. Stephen's going to hate me for saying the word triage. Triage is our clinical way of assessing the urgency and the need and where things go. So the team is going to be 1 or 2 GPs, or 1 GP alongside Simon, or 1 GP alongside with Gemma. So that's our team, that's what we're expecting it to be. So 2 prescribers along with a GP assistant who's going to help us book into the slot. So we're not, you know, wasting our time. We're not using our time, which could be assessing clinical things. Somebody else will be doing the administration for us, and alongside our patient coordinators. GP will have assessed your request for medical advice or an appointment, and we will decide what's most appropriate. Now, if you see somebody and they are unable to help you, and actually that clinician, because remember, our clinicians do know their capabilities. If they think a GP assessment is needed, we will arrange that. You are not going to be without a GP. That's not what we're saying at all. Every person has a named GP, and every request to be assessed will be evaluated by the GP team. Okay, so can I continue to use patient access or evergreen to request prescriptions? Yes, you can. So you can continue to use that, and the NHS app. I really want to say that the NHS app is absolutely fabulous. Please have a look at that. Will patient access or evergreen show appointments? Yes, it will, as will NHS. So I can see a few little comments popping up, and I'm going to address these now. Now, our GP access will be improved by this. My time will not be used looking at a verruca. My time will not be used at looking at a sprained knee. My time will be used, instead of me being filled up at 10 o'clock in the morning, my appointments will be available for longer in the day because they'll be used by the people who really need them. Please, please, please be reassured that we will still be seeing you for your complex issues. We will be seeing you sometimes for your ongoing complex mental health issues. It's not just physical things. It's not just medication. There are some people who we know need to see GPs for some points in their time. But I really want to say that I have people who are better than me at certain things, and we want you to see the best person for that condition. So please be reassured that this is going to increase our access to all members of the team, rather than seeing one person on, oh, that's not the right person, let's book you in with our MSK, for instance. We're going to get you straight there. It's going to save your time, it's going to save your effort. So I really think this is going to work. I'm feeling very confident, very optimistic about this. And actually, we are going to be increasing our access to you, not decreasing. So are admin requests in patches limited the time patches is open? So the answer to that is admin requests will be open for our opening hours. So it will be open from 9 a.m, 8:30 a.m. till 5 p.m. Raj nods. I've forgotten again. Thank you. So no, I think it's 8:30. It's 8:30 till 5. I think our admin is going to be open. So for that, many things are dealt with by the administrators. Again, here's a good example. Sometimes people book in with us for something that is about an insurance letter, and a 10-minute appointment's been taken up by something about an insurance letter. Not necessary. Our administrators can do that. The other thing I want to say to you is that we do an awful lot of appointments that are not booked appointments. Our access at Schopwick Surgery is probably double to what can be booked. So we get things through to us. We get letters, we get results, we get blood results, we get ambulance reports, get all sorts of things that actually we create, clinician-initiated appointments. So we have surgeries where patients come to see us or book these appointments via patches if that's necessary with the various clinicians. In the middle of the day, I'm sure you've all noticed that things get a little bit quieter at certain points of the day, but the DPs and the other clinicians are all sort of locked in their little rooms, and you sometimes hear voices floating out, and that's because we are phoning patients directly. So rather than the olden days, please can you book an appointment with your GP to discuss your sugar results, and then you phone up to book an appointment to discuss your sugar result. Oh, there's no appointments available. We're stopping that. We will be contacting you, to discuss your sugar results and work out what we're going to do about it, just to try and reduce wasted appointments. Now, our do not attend. Our DNA rate at Schopwick Surgery is very low. Thank you all very much for that. Everyone's brilliant at attending the appointments. But we want that to be virtually nil. We're probably, you know, a couple of percent, including our nurse appointments, which tend to, you know, when people become unwell, we understand they can't make appointments, you know, routine appointments. I'm gathering again, aren't I, Raj? Should we move on to the next slide?
Can I just
Sure.
interrupt you for a second, which are a couple of pertinent things. I've been told, this is Moira, I've been told that if Patches is closed due to there being too many requests in one day, to telephone the surgery if it's urgent, and they will find an appointment. Please confirm that reception staff are aware of this instruction.
So we'll come to that. This is our next slide. So thank you, Moira, for that. It's very important. So what happens if we reach full safe capacity? So we have to remember that there is full safe capacity. We think we're going to reach that later than we are at the moment. So once we have reached full safe capacity for clinical queries and appointments, Patches will close and will reopen the next working day. Now we've made a calculation so that we have many more Patches inquiries than we do clinical appointments, because we think we will be able to answer a lot of your queries without an appointment. Now there is a safe limit at the moment. I can look at actually Simon and Raj and I are probably, you know, we're all as bad as each other. Our working days are 12 to 14 hours. Now, this is with a couple of 3-hour surgeries. All the work around it takes a lot of time. And so actually our brains aren't working after more than 12 to 14 hours. And we need you to have appropriate and safe care. So once we have reached full safe capacity for clinical queries, there are several things that can be done. The Patches will close, but as we do at the moment, when we run out of appointments at the moment, we still have a duty doctor system, and that will continue. So we have selected cohorts of people for whom we do not stop access until, you know, we go home. So those are people who are under currently, these are usually patients that are house and bedbound, are children. So are children under the age of 5. We consider that their condition can change very rapidly, and we prefer to assess them rather than not assess them. And we don't accept that a long wait is acceptable for our children. So, you know, pregnant women as well, we consider our pregnant women to need on the day care from us and less. So there are cohorts of people that we consider we will find a way to squeeze you in, as we always have done and we always will at Schopwick Surgery. But the system is different to how it used to be. NHS 111 exists. It didn't used to exist. And NHS 111 are commissioned to provide care for you. Now, they're commissioned in a couple of ways. So number one, they have a home visiting service for those who are housebound, but also the NHS 111 have an ability to book into our system. They have a certain number of slots. So when NHS 111 say, I want you to see the doctor the same day, you say to NHS 111, please book me into one of the 111 slots then, and we will see you that day. That is the sign that they have already assessed you and they feel you need to be seen that day. That is available for you. We also have walk-in centres, and of course, last case scenario is A&E, accident and emergency. So there are lots of ways of accessing medical care. We think that actually our Patches system will last a great deal of the day.
Alex, you're breaking up a little bit.
And we think it's space for you. Oh, okay. Shall we move on? Am I better?
Yeah.
Am I better? Okay, can we have the next slide, please? Next slide, please. Thank you. Okay, so we've mentioned this earlier that
We've lost you again, Alex. Sorry.
we will be at reception and they will do it for you. So that's how everybody can use patches in one way or another, but you may need help to do so, and you will receive your answer on the same day. Raj, send me a private message if I'm really breaking up, okay? I am breaking up. Thank you, Marion.
Yes, okay.
Okay, should we move on to the next one?
I think it's over to me now. So
Is it too bad? Yeah, I'll change my internet.
that's okay. At the moment, it's moving over to me. So now we're going to do our live demonstration. So this is going to explain. I'm going to go through some of the questions that people have asked as well as they go along regarding the NHS app and medication, requesting medications as well as we go through it. Just bear with me with the screen sharing. So I'm going to share the screen and show you initially onto our Schopwick website and then how to access patches. And as I go along, I'll tell you where you can register, how you can submit a request, where to register as a carer or a parent of a child, because that question has been asked quite a bit. And also I'll show you the point at which you can connect this to your NHS app. And we'll walk through a request with one of our test patients and submit it, so you can see on the screen what you will see when you submit a request, and you know where there are some, if there are any small places that you really need to know what the next steps are and how to actually go through it. And I'll talk you through that now. So I'm just going to change my screen share, provided it will let me. Sorry, please bear with me. It's okay. So hopefully, Stephen, can you just confirm for me? Can you see that screen on the Schopwick Surgery website?
Yes.
Perfect. Thank you. Okay. So this is our current website at the moment. As you can see at the top, there's a big yellow banner. This is if you use it on your computer or if you access it on your mobile phone, and it's got most of the information that we've talked about today on here about the new appointment system and the access system. If you click on the yellow banner at the top, it's got an introduction to why we need to make this change. And it's also got some videos made by the wonderful Dr. Hilly on how to register on patches and also how to submit a request. And these are videos that are uploaded to YouTube, but you can click on them on our website and they'll play, and it will show you a step-by-step guide on how to do this. In particular, this is on a mobile phone, and so you can see how to do it on a mobile phone, which is what a lot of patients will use in order to submit these requests. And it's got all the further information on there. So I'm just going to go back to the home page, and I'm going to show you how you can currently access patches. It's important to know that on our website is going to change slightly as of 2nd of October. Not a huge amount, but what you'll find is that the way to access patches, in the center here where the buttons are, there will be a big button that says book an appointment, and there will be another large button that says contact your GP practice, which is for everything except booking an appointment. When you follow those, it will guide you into patches if you just follow the steps. At the moment, to go via patches, there's a blue banner at the top, and it says patches, contact us online. So you can click on contact us online. At the moment, because of our current terms of use with patches, we ask you to explain what's appropriate and not appropriate. This page is going to disappear on the 2nd of October because we'll be accepting a broad range of requests for everything except for nursing, except for booking nursing and healthcare assistant appointments, and after we close with our on-call duty team. So at the moment, if you were to agree to that, it will go through to patches. Now, this is the patches homepage. You can see it says patches in the left-hand corner, which tells you where you are, and it's got a button that says contact my GP practice. It will normally tell you at the top if the surgery is closed at the time you're looking at it, and that's to tell you the surgery is physically shut. So that will happen after 6 p.m. It will show that the surgery is closed. It will also, if patches is closed, a yellow banner will come up saying that we're closed for clinical requests or admin requests. They are separate, so you can be closed for one without another. At the moment, we've opened it for the purposes of demonstrating this to you. Now, if you want to submit a request or register, the first thing you need to click on is contact my GP practice. So if you click on my contact my GP practice, it will then take you through to this page. On this page, it says continue to NHS login. So this is for the patients that want to use their NHS app and link it up to their NHS app. If you click on this on the NHS login, and it will take you through and link it through to your NHS app. If you don't have the NHS app, or you don't like using the NHS app, or you use one of the other ones, such as Patient Access or Evergreen, first thing is I would encourage you to try and use the NHS app, because there's going to be a lot more going through the NHS app over the next few years. The other, if you don't, you can use continue with patches, which is this button over here. So I'm going to do it, show you how to do it as continue with patches, because it displays quite well how to submit the request on it. Now it will take you to a login page. This is the page at which you can either log in if you've already got an account, or you can register if you haven't got an account. With patches, you can create an account as a patient here on the right hand side, or create an account as a carer. When you create an account, so this as a carer also means as a guardian or parent, so you can create an account on there. You need to pick which one you want. It would be better if you had a child, if you picked on create an account as a carer rather than as a patient, because it starts to get slightly more confusing. When you create an account, you are sent you will be able to choose a username and password. You can use that username and password to log in. Now, there are ways to use patches without registering. However, the important thing to note is that if you don't register, you have to put in more details each time you log in, and you can't track on patches where your query is or see your previous requests. You can only do that if you have a login. So it's important to remember your username and password. At the moment, I'm going to put in a username. I'm going to put in a username and password for one of our test patients, who you will see when we log in. Is called Cream Cake. The next page that comes up tells you welcome to patches. Here you can change the language, and it's available in a large number of languages. It will also tell you that the surgery is closed, because it will be telling it just to make sure that you know whether the surgery is open or shut. It will tell you that we're going to respond during our opening hours, and this is going to be the same day, the same working day. If you need help outside, there is always 111, and don't forget that A&E is for emergencies, but it's important to note that there are some things where you do need to call 999 and you can't wait until tomorrow, and patches will try and help you with those things as well by signposting you to them if you really need to. So here you can put a request for someone else, or for yourself, sorry, or for someone you care for. So I'm going to do it for myself. Click on there. Then it asks you to just decide whether you've got a new health problem, so something you've never contacted the practice for, an ongoing health problem, so something your GP practice already knows about, or you've submitted a request before about, an admin request, such as a sick note, or what we now call a fit note, or if you need a letter written, or, for example, if you have an insurance form to complete. If something doesn't fall into one of these three categories, then there is the option for other, and that usually goes towards our admin team. It's important to note that these are all looked at by someone and allocated appropriately to the appropriate person when we receive them. However, we do need to say that when the clinical requests are closed, we will revert to our duty team, as Dr. Byrne has said, but we'll be open for admin requests from 8:30 to 5 p.m. and an unlimited number of those, so you're not going to be restricted on that at all, and we will respond to you as quickly as we can with those and try and process the requests as we do currently. So I'm going to click that I have a new health problem. It's going to then ask you if you have any of these red flag symptoms. And when we say red flag symptoms as doctors, we mean things that are really clinically urgent and things that you really need to get seen in an A&E department for, rather than at GP practice. And that's because they're time critical, or it's too dangerous to wait, and you need to be assessed quickly in the right place. So that's things like crushing chest pain or tightness, which would be a sign of something like a heart attack, your face drooping on one side, not being able to raise both arms, not being able to speak, or having weakness or numbness on one side of your body. So these are symptoms of a stroke. Severe breathing difficulty, which is obviously concerning. Heavy bleeding from anywhere that won't stop, or any severe injuries. If you have any of these and you click yes, it's going to tell you that you need emergency medical help, and it will direct you to the right place. If you do have any of those, please respect that, because this is it being clinically safe. And these are situations where seeing your GP and waiting for them tomorrow could result in a delay, which could result in a detriment to your health. So I'm going to go back now, just so that we can see where we are. So when we go back, I'm going to go into new health problem, and I'm going to say I don't have any of these red flag symptoms. It's then going to ask you, say, these are your contact details. Just check they're up to date, yes or no. They're up to date. it'll tell you you've got half an hour to fill in your request, which is a huge amount of time because you only need a few minutes to complete it at the very most. If you once you've done it once, you can go through it quite quickly. It'll warn you when there's 5 minutes left. It tells you that it'll ask you questions about your problem, and it says that please only submit one request at a time. Important to note that we would prefer if you submitted one request at a time, and that we would address that request before you submit another one. This is so that we can deal with it safely and you can deal with it safely. Of course, if you've got problems that are linked to one another, do mention it in the request. There's an option at any point. You can always add an attachment to add images or documents. So if you have a letter that we haven't received, you can attach it as a document. If you have a photo of something, for example, a skin lesion or a rash, you can add that photo on there and it will add a lot of information for the person looking to see. So you just click start. Now, we're on the page that says make a request. So it's going to ask you, what are your symptoms? So I'm going to put, I have a headache. Okay. It's important when you write this that you try and give as much information as possible. Now, for the purpose of this demonstration, I'm not going to type lots of information and waste your time watching me do that. But you need to put as much information that's helped. It's got a character limit, but it's very large, so you can write as much as you need to tell us more. And the more you tell us, the better we can triage your request. Underneath that, it tells you how many messages you have remaining, and when it says that, it's talking about the number of questions. We've had some queries since starting using patches that there's a button that says submit. It's important to know that this submit button doesn't mean your request is finished. It moves you on to the next question, and it tells you how many are left each time. And you have to go through all of the questions in order to finally submit the request. If you don't finish it and go to the end, it doesn't get submitted and we don't receive it. We've fed back to patches to try and change the name submit to, for example, to something like continue or next question. We're waiting for a response for them on it, and we're hoping that they'll respond and change the way the button is phrased so that it's more appropriate. But for now, if you see submit, press it and look for the next question. So the next question is, what do you think may have caused them? For example, migraines. It says 8 remaining. You can see it will go down. So you'll keep on putting it through. Is there anything you're particularly worried about?
Can I just stop you for 1 second, Simon? Raj, at the top, it says change language. So if English is not your first language and you don't think your English is very good, you can change it into one of the languages listed, and it will somehow translate it into English for the doctors to see. But that's only if your English isn't very good. Thank you.
Okay. Thank you, Stephen. Yeah, that's very important. And it will translate using translation software. So it's important to know that it's as accurate as it can be. But in that scenario, if you needed to see someone face to face, we would use language lines, and we would use an interpreter in order to do it properly. So it'll ask you if there's anything you're particularly worried about. Now, these are generic questions. Sometimes the patches will narrow down specific questions related to your problem if it thinks they're really important. So for example, if you have cough, it will ask you about breathing symptoms, and it will do that. It tries to do that as intelligently as it can. It has got some artificial intelligence built into it in order to try and learn and try and get the information it needs from you, so that you can really get a really good request in, so that it can be triaged properly. It says how long has the problem been going on. So I'm going to keep going through these questions until you get to the end, and I'll submit a request. It's asking if it's getting better or worse or staying the same. I'm going to put staying the same. And then when we get to the next few questions, you see the last 3 questions, there's an option to say something or skip the question. You still need to, even if you don't want to answer these questions, you have to go through them in order to complete your request and for it to be submitted. So this is where some of our patients who first started using patches when we put it on our website have had some issues. If you know that you keep pressing submit, it will go through. So is there someone at the practice you'd prefer to help with this problem? We will try to give you continuity as much as possible, especially if we think you need it for that specific problem. So do tell us if there's someone you prefer. We will do our best, but we can't guarantee it. For example, if they're not in that day that you want to come in, and in that case, you will try and allocate you the most appropriate person. If you don't want to, you can press skip, and if there isn't someone in particular. And this is if you have any other thoughts on how you'd like the practice to help, you can write it down. Again, for the purposes of this, I'm going to skip it so we can get through to the end and you can see what it's like and how to complete it. This is a really important question. If there are times you're unavailable for the practice to contact you, please put them here. Now, it just says unavailable to contact you. We would like patients to be really specific about this. So tell us when you're not available to take a phone call and when you're not available to come in for a face-to-face appointment. If you're really specific about this, we can offer you an appointment when you're free, and it will make the process really easy for you. And it will mean that you won't need to call back to change your appointment. So please be really specific about when you're not available, both to take a phone call or to come in, depending on what we think that you'll need to assess your query properly. So I'm going to skip that for now if I'm free all the time. Now we've reached the end of it, and it says please check your responses, which you can if you wish to, and then you have to press confirm. When you press confirm, it's added onto your medical record, and it's with us for us to respond to you, and we'll get back to you the same day. But until you click this confirm button, it's not submitted. So make sure that you've clicked confirm, and so it will go through. It will then tell you, for example, at the moment, because the practice is closed, it's telling you that we're closed and you'll need to wait until we're next open to get a response. And it just wants to confirm that you know that we're shut and whether you're going to want to get advice before we open again. If you do, it will tell you, you can set, you have the option to say you're going to call 111, or you'd still like to contact us at our own, contact us at your own risk. Now, the way it phrases it is obviously to make you aware that there are risks of submitting something if you have got a red flag symptom. But as long as you stick to the red flag symptoms and and if you feel you need to speak to someone that evening, you click on calling 111, that should be okay. So I'm going to click on, for the purposes of submission, that I'd still like to contact, so you can see what comes up on the page. It'll say thank you for contacting Schopwick Surgery, your name at the top there. It'll tell you the request has been received, and it'll tell you how we'll respond, and will it respond during our opening hours as soon as we can. Now, we're looking to make sure we respond to everyone the same day, which I'd like to reinforce. We will get back to you by either a text message or a phone call. We will note how you submitted the request, and if you're someone who struggles with technology, it will be a phone call rather than a text message. And sometimes, if we think it's medical advice that you need, we can respond through patches, and it will notify you that we've responded through there, and our response will be visible inside the NHS app, the Patches app, or online when you log in. It's got your contact details confirmed there, and it tells you to call Schopwick Surgery if you hadn't heard from them in 50 working hours, which is not going to happen because we're going to get back to you the same day. Or if your symptoms change, and it tells you where to go if you need outside help or help before we close. I just wanted to answer one particular question about the Patches app. Patches has its own app, which is different from the NHS app, and you can use the Patches app. To use the Patches app, you just need to download, you search Patches, P-A-T-C-H-S, in your App Store or your Google Play Store, depending on which type of phone you've got. You download the app and you use your username and password to log in, and you can then use that username and password, link it to your fingerprint, however, depending on how tech savvy you are, and you can use that to submit requests as well, and that's also quite helpful. But it would be better, I think it would be most useful to try and use the NHS app. For your repeat prescriptions, we're still going to ask patients to use the NHS app because that system is working well, and more and more things are going to be put through the NHS app. For medication queries, it's best to use Patches because we will have dedicated pharmacy team who will look at your medication queries the same day, and so you've got an appropriate person to deal with it. It's better to do that for medication queries rather than use the NHS app. But for repeat prescriptions, continue to use the NHS app. If you sign up for Patches, it will, and link it to your NHS app, it will not deactivate anything. You'll still be able to use it to request your queries. So when you've finished on here, click on finish, as it says, and it will ask you how to rate your GP practice and your Patches system today, and ask you to submit some feedback, and then it will close. So I think that's it for the live demo today, and I'm now going to pass it back to Stephen so that Stephen can open to any questions.
Okay, thank you very much, Dr.
It's all going tech, and I've got to do everything on the computer. Too old for all this.
Okay. Thank you very much.
Well, I don't know. They're changing everything over. I'm watching a Zoom conference.
Yes, would you mind muting yourself, madam? Thank you very much. Okay.
Okay, that's fine. It takes about 3 weeks to come through, doesn't it?
If Alan can find
Okay, I'll put a message on it.
them, thank you. We had an email earlier on today, or even yesterday. She'd like to know how the system expected to operate. They sent a thing through Patches, an application through Patches, and they had no response after several days. I had to phone and hold on for a long time in order to speak to a receptionist. Well, my first attempt at it was that when I signed on and started answering questions, I didn't realize that the submit button was not a submit in the normal way, that you submit your question and it gets answered. You have to keep continuing answering the questions until the very final point where it says, I think it says complete, and then you will get a confirmation up on your screen telling you that you have filed your submission. I couldn't get on with this for the first couple of times, and I had to speak to those in the know how to do it, and I found that I was making mistakes. So that's one of the reasons we've had all this tonight, is to make people understand how to use it. So I hope that's answered your question, David. I will send it through to the surgery to make sure that they can follow through and see what possibly happened. If they can't find it, then what happened to me happened to you. We've had a few questions here that they can't find the NHS, the Patches app on iPhone. I haven't looked, but I'm sure if...
Get it through Apple.
Thank you. I'm sure it's there. My earlier point about logging into Patches via NHS web still applies. The process seems to be rather convoluted. It does seem a little bit convoluted in the first time you do it because it's absolutely new. I've used it a few times myself trying it out, and it does get much easier. And of course, the time taken to fill the form in gets much quicker because I know what it's going to ask me, so I know what it's going to, how I'm going to respond. So if Dr. Badiani has anything else to say about that, I'm happy to let you answer.
Yeah, I was saying, I think if you have a request that doesn't go through, we're going to respond the same day. That's what we're trying to do. So if we haven't responded, something has gone wrong. So it's important that if we haven't responded to you the same working day, you can phone the surgery. Now, at the moment, obviously, we're hoping once this new system is launched, our phone queues will be shorter. So you can phone the surgery and ask us whether or not it's been received. Or if it hasn't, you can simply resubmit it. And if it's not gone through, we'll facilitate that for you. But it's like Stephen said, you really have to press all the submit buttons, and the last 3 questions, you either have to answer them or skip them until you get to confirm. And until that happens and it's set and you get to that page that says, thank you, your request has been submitted, your request is not submitted until you reach that page. So that's really important. There's some questions coming through about the Patches app. The Patches app is available on Android. If you search for it, just search Patches, but make sure you spell Patches correctly, because the spelling is not like the term patch. So the Patches will not have an E in it when you add an S at the end. So it's PATCHS. I know there is because I've got it on my own phone. If you have any issues trying to get these apps, you can ask at the surgery, and we'll try and help you with it as best as we can. But they're available in the Apple Store and the Google Play Store for Android, and you can download them as well. It's quite helpful to do it through the NHS app though, if you have it, because everything links in quite nicely.
Okay, fine, thank you. if you're already registered, do you have to re-register again? I think the answer is no. After the 2nd of October, I think the answer is no. It will just transfer over. Somebody asked, what happens to all the data that you submit when you log in or set it all up?
So I can take an answer to that. I can try and give an answer to that question. So as you do now, the consultations are saved onto your medical record as verbatim as they are written, including the responses from the clinician. So you see the full online consultation stored on there, and it's also visible on your medical notes online. So you can, when you submit these, they're all stored onto the record. Patches itself has its own its own system where it stores your consultations so you can see them before. But as with a lot of the providers that do this, they have their own GDPR policy. They don't share your data with anyone else. The only place they save it is onto the clinical system that we use in order to use your medical notes.
Okay, somebody asked, can you use patches to make an appointment to see the practice manager? That I don't think is the case, because the appointment system doesn't have appointments for the practice manager. If you wanted to speak to the practice manager, you'd have to phone in and request such, but she doesn't have a appointment diary in the first place, so we don't need to. Alex, you've raised your hand.
Hello, I just wanted to say one thing about the practice manager. We have a practice. Oh, can you hear me?
Yes.
Okay. We have a practice manager team. So there are lots of different people who may be able to answer your query. So any inquiries that you think may be in the practice manager's direction, please put through to the admin, and we will get it through to the correct team member. Practice managers have many different jobs, and you know, it may be somebody different who is able to answer your question.
Thank you, Alex. I saw somebody ask about registering for their children, and up to what age their children should be registered through a carer or as a parent. Perhaps somebody would like to answer that. And also, does it always go through an email address? Because a child doesn't necessarily have an email address. So how does it work if you've got 2 or 3 children?
I can answer that. So when you register as a carer, it's going to ask for your email rather than the child's email. Now, obviously, that means that the response will go back to you. At the moment, children, I believe, please correct me if anyone knows if I'm wrong, will be classed as under 16. So under 16, and so for them, you'll need to register. If you're doing it for them, you'll need to register as a carer. Obviously, some children can actually do this themselves. Even if they're old enough, they may actually know how to do it themselves and want to respond themselves, but that's very dependent on the child and their maturity as well as their age. So I hope that answers your question.
Yes, thank you. Alan, have you got any other questions that I'm sort of missing out on? Because I'm scanning through them as quickly as possible. It's one question: can we create an account as a carer using the same email address as used for our own NHS login? I think you've answered that. Yes. What is the website for patches? Oh, right. Okay. Unless anybody's got a question. Oh, there's lots of questions coming in. Let me have a look. Still confused how I connect Patches account to the NHS app.
I can answer that. There's when you go to the where we did the walkthrough, it said continue to NHS login. It should use that to link fairly intuitively. If it doesn't, there's a guide in the help section on Patches on how to there's a whole page on how to, in the help section, on how to link it to the NHS app and use it using the NHS app. I'll try and find where on Android store to answer some questions about where this is, and I'll put it on the practice website, how to download the apps. I'll do that. I'll find it and search for it. I've managed to do it on my phone, so I will find out exactly how to do it and put it on the practice website. So bear with us on that. You need the login anyway, so you can still use it via the internet and the NHS app at the moment.
Okay. Somebody asked if we find a bug and not a bug of a medical nature, if we find a bug on the app, who do we report it to?
Patches has their own system of reporting back. If it's something that you think we can help you with, you can always ask us. We'll try and help you with it. We know that these changes can be difficult, and so we would like as many patients as possible to use the system efficiently.
Okay. Somebody's asked, can the host please post the link for the Google Play Store? So I will email, or we will email the apps to you, the app pages to you, so that you can see exactly to where you can get them from. I've also got it downloaded, so there is no problem, and I have an iPhone. Can you book ahead for a day later in the week?
Yes, you can. So we've got some appointments ahead. Including our early morning and late clinics as well, and in the morning, but not super early as well. So we've got all the usual appointments too. So yeah, you can, and we'll be constantly reviewing the system and access in order to try and make that easier and easier.
Okay, somebody's just saying, Angus is saying it's not an app. You have to Google it, but that's not true. There is an app.
I think to an extent he's right. It comes on your phone as an app, but I think the way of getting the Patches app is not when I'm searching the Google Play Store now, I can't see it. I was fairly sure that I got it from there when I did it on my own phone initially, but I will find out, and if you don't mind, Stephen, I'll ask if we can send it to the people that attended the meeting and post on our website.
Yeah, okay, fine. There's a few more messages coming through at the bottom. Moira, also please away not linked to NHS. I do not want the NHS app on my device. Thank you. I'm not quite sure what she's.
You don't, Moira. You don't need to link it to the NHS app. So you can use it just with a username and password on the internet or the Patches app. On my phone, it's not linked into my NHS app yet. So you can just use it with a username and password on an internet browser like Google Chrome. Or Safari, like you do now, or on your computer.
As this Zoom meeting is being recorded, where can I see it later? So we're hoping to put it onto the internet, onto the website, the Schopwick website, in a few days' time. I'm thinking about whether to send it to everybody who has attended the meeting this evening, and that's probably the easiest way, so you can go over it in your own time, at home, in your own leisure time. Anything else? Still, anybody else see?
I'm calling.
Hello?
Hello, can one call in? I'd like to ask you how many people are watching and listening to you tonight.
There's been over 200 people listening tonight.
And the reason I ask is, yeah, I think the practice has got about 25,000 people. It's so, the reason it's so low. It was so difficult to get onto it. And that's why it took 20 minutes to get on, because you didn't give the right things to do.
Well, there were 400 people registered. Some people cancelled, and we haven't got 25,000 people.
Well, how many have you got?
Well, I'll leave Alex to answer that.
So we have just under 15,000 members of Schopwick Surgery, and already, what was it? I asked today. sort of 3,000 have signed up in advance.
See,
Sorry, Raj, go for it.
it's really very good. I totally go with it, totally. But you've got to make it easier. Please make it easier. I'm 83 and my wife's 83. You've got to make it easier. I'm not aggressive at all. It's a wonderful Schopwick is everybody is, but it's not easy for this. But you know, you've got to do something about it.
But you can still do it in exactly the same way that you've been doing it for the rest, you know, your life as a Schopwick patient. You can still phone in, and if necessary, you can still turn up at the practice. We're not saying you can't. Some people will find it very easy. Some people are computer literate and find this sort of thing very, very easy. But if you can't, or it might take you too long or whatever, you still have the options as before to phone in or to visit the surgery. We prefer you not to, but those options are still there.
Could you arrange that?
Okay, Alex, you've still got your...
No, I was just going to say, please don't test it out. Please don't test it out, especially on day one, because I'm doing day one. I don't want it to be filled up with people just testing it. Okay, yeah. So please just, you know, prepare yourself, get your logins.
Okay, fine.
Be ready in that way, but don't send tests on day one. Lovely. I just want to say thank you so much to the PPG for hosting this. It's been just tremendous to try and get a flavour of it. It'll feel a bit different on the day. Shall I leave it with Raj to say the final word, or should we leave Stephen?
Raj,
yeah.
Do you have something?
Thank you to all the patients for joining us. We hope it's been useful for you in order to show you the new system, and massive thanks to Stephen and the PPG for hosting this event. They're helping also trying to develop the system has been invaluable, and so we'd really like to thank them for that. And on that note, I'll hand it back to Stephen.
Okay, thank you to Alex, to Simon, to Raj, to Nicholas for joining us this evening and walking us through it. Like anything with computers, anything new is difficult for the first time. I'm holding my hand up and saying I found it difficult. Once I'd seen this walkthrough, I immediately became much more confident with it and happy to use it. So thank you all to everybody for joining us this evening. We will make this available online, and also I will email it to you in a few days' time. Thank you for joining us in the meantime, and stay in good health. Thank you very much for joining. Bye-bye now.